Dr. Carol Rattay. I'm the director for Delaware's Division of Public Health, and I want to thank you for watching our Zoom podcast today. As the COVID-19 outbreak continues, we have shifted from doing Facebook Live to Zoom videos to ensure that we all can follow social distancing practices. And of course, we recognize that this is all a big change in our lives. And as we've discussed before, we worry a lot about the mental health impacts of social distancing and what's going on in the world around us. And we're also very concerned about the impact on those who are struggling with a substance use disorder and their families. And so I am so grateful to have our Lieutenant Governor, Bethany Hall-Long, with us today, and the Director for the Division of Substance Abuse and Mental Health, Elizabeth Romero. So thank you so much for joining us. First, I'm going to provide just a little bit of an overall review of where we are right now in Delaware. As of Wednesday, April 15th, we have 1,926 total laboratory confirmed cases. The age range is from 1 to 97. As of Wednesday, April 15th, we had 217 individuals hospitalized in Delaware hospitals. 45 of those were chronically ill. And we also saw 87 residents in our long-term care facilities who are positive. And sadly, 46 deaths in the state of Delaware to date. So I want to transition to Lieutenant Governor Bethany Hall-Long to help us talk about a little bit what's going on, what you're hearing about those with substance use disorder and their families and the challenges that they are dealing with at this point. I will share that approximately this time last year, we had 70 suspected overdose deaths. And as of April 14th, we had 104 overdose deaths in our state. And so we are extremely concerned about this. And this is why we have Lieutenant Governor Bethany Hall-Long, who leads the Behavioral Health Consortium and is a staunch advocate and champion for substance use disorder and the families and individuals who are dealing with these challenges in our state. So thank you, Lieutenant Governor, and I'll hand it over to you.
Thanks. Thank you, Dr. Rattay, for that opening. And it is truly a pleasure to be here today with you and also with Director Romero. As you indicated, the issues around substance use disorder and mental health have never been more pressing than they are today with our COVID pandemic. And I can share with you, in my capacity as the chair of the Behavioral Health Consortium, I've had the opportunity, as you know, we have some fantastic members of the commission who have continued during this crisis to show their leadership. And this past month, we've had the chair of our Access and Treatment Committee, Dr. Sandra Gibney, has worked in hand with the Department of Health and Social Services, particularly through you in the public health sector, to be out on the streets, working not only with individuals with substance use and mental health disorders, but individuals who are most vulnerable, such as our homeless. And I can share with you, wearing my PPE, which I carry everywhere, my mask and gloves and shield, I've had the opportunity to be on the streets as well. And during that time, you're spot on. We are seeing that individuals are experiencing more anxiety and depression. And it's all sectors, it's all zip codes, it's all backgrounds. Whether we are a white collar worker or blue collar worker, I'm finding as I go door to door, we're on the streets talking to individuals. Unemployment's higher, children are at home, they're not used to having to homeschool, so to say, and there's a lot of stress. And so we're hopeful that today we thank you for this opportunity. And I really just want to mention, trust telehealth. We've worked really hard in our state to get that in place. And it's available, as I know our Director Romero and others will share, that we have it available. There are free services. If you have private insurance, we have made those changes thanks to your leadership and Governor Carney's leadership with telehealth to make sure that it's covered. So we want individuals to not suffer alone in isolation. And again, we are in the midst, as you indicated, not only of a pandemic, but we're still continuing with the opioid epidemic in the midst of a pandemic. And so we're losing every 22 hours a loved Delawarean, a parent, a child. And so together, and today, hopefully after we hear from our colleague from DSAM, we'll be able to share those resources. And I hope that all viewers and listeners turn to the Help Is Here line, the Bridge Clinics, the mobile crisis. It is never too late to not pick up the phone. It is okay to not be okay. And so with that, I'll turn it back to you, Dr. Rattay. Thank you.
Thank you so much for those comments. And now I'm going to hand it over to our Director of DSAM, Elizabeth Romero, to tell us a little bit about what you're hearing and seeing from, on the ground in our state, and some of what DSAM is doing to help support families and individuals through this challenging time.
Thank you so much, Dr. Rattay and Lieutenant Governor Hall-Long, for hosting this event, because it's so critical for us to be able to get people connected to care, understanding what's out there. It can definitely feel right now during this time, especially as we listen, that folks feel isolated, they feel lonely, they feel like they don't know who to talk to, and especially because of the stigma. So many people so worry, like, oh gosh, I'm feeling so anxious, or I'm feeling depressed, or they may not even realize they're having those symptoms. So maybe you start yelling at someone that you love deeply and don't realize that afterwards you go, why did I say that like that? Maybe you can't focus as well that you normally would focus. Maybe you find that you begin wanting to go back to doing some of the things that you were doing before that helped you, whether it be alcohol or drinking, or using some different things that help you feel better. And those self-medicating things are things that we worry about. We know that it's okay, as the Lieutenant Governor says, to not be okay. It's okay, and you are not a bad person if you feel like, wow, I'm feeling these things, or I feel like I want to go take that drink, or I want to go and go to that bottle of pills that I used to not use before, or maybe try to find some substances that you were not using before. And those are the things that we say, that's the time to reach out for help. And so we actually have kind of rebranded our crisis line to be Crisis and Care, because we know that people sometimes just need to pick up the phone and talk to someone. And that number is 1-800-652-2929. Again, 1-800-652-2929. And obviously, you can go to helpishere.de.com, and we'll have resources there for you to find different groups that you can join. Maybe you don't want to talk to a counselor. Maybe you want to go to an online support group. And so many providers across the state are setting up things just like this. So maybe right now where you see Dr. Rattay, that might be somebody, a peer, or somebody leading a group. And then there'll be folks that, as you can see from the gallery above, who might be on and just want to talk about their feelings and what's going on, or maybe they want to even just do an activity together. So there's different types of things going on across the state to support people so they don't feel alone. And that's where, again, like the Lieutenant Governor said, telehealth is actually a great way to talk to people. We find all of our providers have quickly moved to being on telehealth. You can set up a televideo appointment. You can set up a telephone call in which they'll go through different, go through all the different things that you're used to going with your counselor. And on top of that, you don't have to drive to figure out how to get there on time. You don't have to figure out someone to watch your kids while you're doing that. You don't have to find a babysitter. You don't have to schedule and make sure different things with your spouse or your loved one is in place. You can just go to a quiet part of your house and just have a phone conversation with someone. So it's so easy to do. And what we're getting feedback on is once people try it, they really like it. They like being able to just go on, and have that moment to be able to talk to someone and not worry, or even do it while they're outside taking a walk, talking and walking and talking to someone while they're going through that. So we're finding that providers are finding that when people do the telehealth appointments, they're actually more likely to keep the appointment. They have better no-show rates. So that's pretty exciting. And then also allows people to engage their family members sometimes. Maybe this is a time where, maybe you want to bring your loved one who is you're struggling to communicate something with. So they're actually finding that it's been a great way to be able to help encourage families to even better communicate together. So again, we have many resources to connect you to in our state at helpishere.de.com. As well as if you just want to pick up the phone and talk to someone, our crisis and care line, as well as our bridge clinics are there for you. And our bridge clinics are all by telephone, or you can make an appointment and walk in.
Great, thank you so much. So I'm going to ask some questions. One question that is of interest, are you getting more calls for treatment, either via the Bridge Clinic or our treatment partners getting more calls and referrals?
I think in the beginning, when the pandemic first really started taking hold in Delaware, a lot of folks just was really focusing on what does it mean to shelter in place? What does it mean to homeschool all of a sudden? What does it mean to be with your loved one 24/7? So as people are getting back to trying to create a normal for themselves, we're seeing sort of a steady connection to appointments. So we have access for that. And, we sort of anticipate as people recognize this new normal for a bit, that they're going to need more access to supports. And so we want to make sure ahead of time that people know there's a place to call. So instead of feeling like maybe I have to yell at this person, maybe pick up the phone and talk to someone. And that's what we want to begin helping people as they adjust to the feelings that they're having.
Great, thank you. So this is a question from Dave. I'll toss this to our Lieutenant Governor first. He says, we are seeing a massive response to this pandemic and other epidemics across the country and the world. Why don't we see the same reaction to the opioid crisis?
Wow, that's a good question, Dave. And I think there's a lot of social factors that come into play here. Again, it's a misunderstanding. And as most of us recognize that behavioral change also is significantly tied to your mental health and cofactors. And what I find when I'm out on the street as a nurse or teaching as a nurse or working with my colleagues here, Dr. Rattay and Director Romero, when we sit at the commission meetings, it comes down to, unfortunately, stigma. And I happen to have one of my favorite cards that says mental health and addiction can affect anyone. And no one has to struggle alone. And that's what I find. There's a shame, unlike other diseases, whether diabetes or cancer, where people can openly discuss their challenge. Things with brain health are more stigmatized. And so unfortunately, we have individuals, whether it's a corporate CEO or a small business entrepreneur, a young college student, to a vulnerable veteran or someone who is homeless, the common denominator is people are embarrassed. They don't want to admit that perhaps they have depression, anxiety, bipolar disease, schizoid affective disorder. There is a stigma. And so we have to tackle that epidemic. And so in the midst of our pandemic, this epidemic continues, and it is an opportunity. And thanks to our wonderful leaders here, as Dr. Rattay and Secretary Walker and Elizabeth Romero, we can wrap our arms around this. And the final thing I'll share with you, Dr. Rattay, is we want others to speak up, whether it's our stakeholders in our nonprofit community, our ministers, whether it be our Department of Education players, reentry coming out of the correction system. It is really all hands on deck. And I think as we have tried with the Behavioral Health Consortium to break those silos, we've continued to meet that barrier of stigma. And so to each and every one of us, let's make it a challenge this year as COVID hopefully passes and the pandemic ends. Let's really roll up our sleeves and address mental health, behavioral health, and brain health in our state.
Great, thank you so much. Elizabeth, let me ask you a little bit about substance use disorder treatment services and how they have changed for individuals. You've talked a little bit about telehealth. What about individuals who are either receiving medication-assisted therapies or need MAT? How has the crisis that we're in the midst of changed what those services look like?
Absolutely. We're very grateful for SAMHSA in providing guidance to us in the state, as well as Medicaid and DMMA, to be able to give our providers, but basically to all Delawareans with a substance use disorder, the tools they need to be able to stay in place and get the treatment support they need. So one of the things SAMHSA did immediately was help us do take-homes. So if you work with your provider and you need to have a take-home for your MAT, you can absolutely work with them to set that up that best fits your need, whether it's a 6-day take-home, a 14-day take-home, and for some cases, a 30-day take-home. Again, that's one thing that the federal government and Delaware's Medicaid work very hard. And then on top of that, adding that telehealth component. So following up with people to make sure that they're okay, and checking in with them to do brief counseling appointments over the phone or by video. We've seen our providers really change their practice literally within a 1 to 2 week space in order to be able to provide and serve Delawareans with a substance use disorder immediately. So no one was dropped, no one was falling through the cracks. And we really tried to make sure we did that with social distancing in mind. So it took a little bit of time for our providers to get up and running, because obviously they had to order certain types of supplies that they needed and get used to having a new procedure and protocol. But I have to say our providers rose to the challenge, and they've been really there to try to help people. And even our inpatient withdrawal management, as well as our residential treatment program, they worked hard to stay open, hard to take new admissions. And so they're really trying to make sure that they are responsive to the needs of those like you in our state that need help.
Great, thank you. Thank you for your work to help transition us to this new way of delivering services. I do want to add to that, I see a question from Tiffany, who was asking, do these take-home programs, is there a concern that they lead to either abuse or people selling their medications?
That's a great question, Tiffany, and we'll be able to say is that we work and trust that our providers know who is at greater risk and might need shorter take-homes. And at the same time, we were balancing it with the risk of spreading a coronavirus through an entire vulnerable population. So we really tried to find that balance between making sure people stayed safe, and at the same time, people were also getting the social distance safety that they needed so that they also did not have to experience coronavirus or spread it. So that was a real challenge for providers. Again, they worked hard to do that and really work with our those who have an addiction to be able, or substance use disorder, to make sure that they knew and could get the support that they needed. But thank you, Tiffany. Great question.
Lieutenant Governor, this question comes from George, who says that a lot of seniors now are isolated and feeling alone. What tips do you have, or do you know of, do you have any guidance or suggestions for seniors where they can connect with people while staying in place?
That's great. Very good question. And as you know, our seniors, as you see, and unfortunately in the data that you shared earlier, the majority of our deaths have come in the elder population with, just their overall status of health and immunity. And I have to say that for the senior population, I'm not sure how many of them are going to see our Zoom or our Facebook, here today, but we really are relying on what you have in the frontline service providers of getting the information out, whether from their care provider, but also having them contact and stay socially connected. We see the pictures of the grandchildren on the phone and people visiting. We encourage neighbors to be good neighbors. This is the chance when you can step up. Doesn't mean you go into their house and spread more virus, but it means, making sure meals are delivered. I've been so fortunate that our office, through the governor's leadership and many across our family cabinet council, have worked really hard on a strategy. One of ours is through our faith-based community. We have a toolkit that's in place, and the seniors have been very much a focal point of that. And so to the seniors, they can stay in touch with their local senior center who is providing different services. We have still Meals on Wheels and the food bank working with particular programs. And certainly one of our compadre directors that's not with us today, but Renee Beeman and her work at the state service centers, there are a lot of strategies. So no senior should be home alone, hungry, and without companionship. We can provide that through telehealth, through phone calls, and through visits, socially distant. And so thank you for that question. And if individuals have contact information, I know at the end you're going to be providing the 211 and some other information where we can link seniors to someone else to keep them not feeling so alone.
Great. That was an excellent and helpful response. And yeah, I think we can't say 211 enough, right? Because it really is an important go-to number that where people can get a lot of information and support depending on what their needs are. So thank you so much for that. So the final question I'm going to ask for Director Romero is, in this time of social distancing, what is the best way for a parent to reach out to someone to talk about their teen or 20-something child that they may be worried about?
Yeah, one of the things that's, you can't help but notice, but when you're with someone 24/7, some of those suspicions that you weren't aware of before, or you're a little worried and you just want to talk it through with someone, it doesn't mean anybody's a bad person. It doesn't mean anyone's a failure. You're just trying to proactively help your loved one, and you just want to check in. We actually have a free service for you to have you speak with a family coach that'll just talk you through some ideas, help you look for signs and symptoms, but then help you actually with the actual conversation. Sometimes when we're not sure how to address something, I have a high schooler and a college student. Sometimes I'm never sure what's the best way to approach something where they won't shut off. And that is something that is always hard when you're dealing with 18-year-olds to 26-year-olds, because they want to be left alone, and at the same time, actually even 16-year-olds, 13-year-olds. But at the same time, trying to actually have a productive conversation when you're worried about something is really hard. So when you go to Help Is Here DE, there actually is a connection to a program called Partnership for Drug-Free America. You can actually text HOPE DE, just text HOPE DE, and you'll begin getting an immediate response to schedule an appointment with someone, and they'll help you over the phone kind of think about what's the best way to have the conversation so that I can actually get a response that will be helpful and help me feel a little bit better, or how maybe this will open the door up so that I can actually help my child or my loved one get the help that they need. So again, if you go to helpisherede.com, it's the Partnership for Drug-Free America, or text HOPE DE, and we can make sure that you get connected to a family peer who's been through this. And they have no judgment. They've been there. They come from all walks of life, of folks that can just say, hey, we understand that this is hard. And sometimes these are really hard conversations to have in a closed environment. So having some tools to be able to say, well, how can I ask this in a way where they won't get angry? Or if they do get angry, how can I respond in a way where it doesn't escalate? So there's some really wonderful things out there in that, and we really want to make sure that families have that. It's a free service for you. You get 5 coaching sessions with a family person that actually kind of help talk that through. And they also have some online family groups as well that they've developed, so that you can listen even to what other families are going through. Maybe you're not ready to talk to someone. Maybe you just want to hear. So we think that all of those things are the right things, and only you know what you need.
That's fantastic. And as a mother of teenagers, I'm glad to be reminded of that resource for sure.
We're all laughing on that.
I know. Well, the cool part is some of our providers actually, and we're going to start posting them on the Help Is Here DE Facebook page and on the actual Help Is Here DE website, are virtual resources for some of the different online groups happening. Whether you're a behavioral health provider, there's some behavioral health or essential worker support groups that you can join. There's from Jewish Family Services, some family support groups that are happening. As well as, this is the one I always laugh, support groups for parents of teenagers and parents of college-age students. That too exists. So those are great ways to connect to other people and hear how we're not alone. I mean, we're all struggling through this. I don't think there's a single person who hasn't been affected. So I think we have to recognize that when you see a friend that might be struggling, encourage them to go to the website and see what's there, or give a call to our crisis and care line, and we'll try to connect you to the resources as well as Delaware 211.
Awesome. Well, as we close, I just want to remind folks, for all information about coronavirus here in Delaware, go to de.gov/coronavirus. And of course, you've heard repeatedly, 211 is our go-to resource for services, and including to talk to somebody about coronavirus questions, even about where to get testing, or 711 for the deaf and hard of hearing. Or you can email health-related questions to dphcall@delaware.gov. And of course, information on treatment and recovery, a variety of different resources are at helpisherede.com. So please keep that in mind. Lieutenant Governor Hall-Long, thank you so much for taking the time to be with us.
Thank you.
Today.
I'm advertising your new Narcan before we sign out. Naloxone, right? We forgot to mention free naloxone, or naloxone is available.
Can I give you a minute to talk about that?
Yeah.
Oh, sorry.
30 seconds. I meant to do this. I had my little package here. We do want individuals to know that there are different providers who are trained. If you have a loved one, or if you work at a work site where you know individuals might be at risk at these high risk times, we do have the antidote to the heroin and fentanyl, the naloxone, available. And so just wanted to put that plug out there as well. Thank you, Dr. Rattay, as we round out this session. Thank you for having me participate today.
Yeah, thank you so much. And that's one of the most important points of our session, right? So thank you for bringing that up. And for more information on naloxone, helpisherede.com has more information about how to get it. And Elizabeth Romero, Director Romero, thank you so much for being here today. Really, really appreciate it. And Pamela, thank you. And Pamela, thank you for helping to translate our conversation. We really appreciate it. Have a good day, everyone.
Welcome. Thanks.